Hey guys, this is Manu, physical therapist and Ayurveda herbalist. So today I wanted to talk to you guys about, I wanted to answer a question that some of you guys asked, which was about pain on the inside of the knee when running. So if you're having pain on the inside of the knee when you're running, you want to really look at not just locally at the knee joint itself. You got to look at what's happening at the foot and up at the hip too, maybe all the way up to your spine and pelvis. Okay, so then first of all, the pain on the inside of the knee can be either irritation of the meniscus, it can be irritation of the MCL, which is the medial collateral ligament that sits on the inside of that joint. It can also be, and most often, or more often, you can also have irritation of your patellofemoral joint or patellar tendon, like patellar tendonitis or tendinosis. So it's the kneecap, which is that patellofemoral joint. Your kneecap is basically sitting on top of the groove created by the femur, which is your thigh bone. So here's your thigh bone, here's your tibia, and on top you have the patella sitting there, right? So it's how that patella glides up and down in that groove. So if there's a change in the alignment of the patella due to structural issues or due to imbalances in the local muscles, local or muscles that are above or below the joint, or there's tightness in the tissues, or there's just restrictions, adhesions that have formed because of constant chronic irritation that's taking place in that tissue. Remember, if you have pain, inflammation, irritation that continually goes on in a tissue, the irritation, your body's response also is to often for the area to become thickened, lay down more tissue in that area. So if things are kind of tightened up, adhesed, they're not moving properly along that inside border of that kneecap, you can also have pain coming from that tissue too. So keeping in mind, you want to correct the patellofemoral mechanics. That's one major component to do. And then, of course, also see whether it's the medial meniscus inside the meniscus that's causing getting irritation from the constant pounding or the increase in load that's being placed on that structure, or the MCL, which is the medial collateral ligament, which either is irritated or is getting constantly stretched because because the mechanics are off in the lower leg. So first of all, that kind of gives you an idea what are some of the common structures. Of course, you can also have you have all these other structures on that inside too. Your adductors are there, even your hamstrings, part of the hamstring, but that's posterior, is in the back of the knee. So usually these are the common ones that are going to give you that problem, that inside of the knee issue with running. So then you want to think about what else is going on in terms of your mechanics that's causing that problem. So that's what you need to look at. You need to go down to the foot first. You got to see, okay, do I have flat feet? Does the person have a high arch? Are the local muscles in the foot weak? Is there not enough flexibility or mobility in that ankle or some of the other joints? That's changing the way my foot hits the ground, so for example, if I have flat feet, if this is your foot, if the arch collapses down, it makes that leg drift inwards. So the leg drifts in, which creates increased load on that inside of that knee. So that's where some form of, either better shoes or more specific shoes for that person, or some form of inserts or arch support might be beneficial for that person. Or improving the strength of the foot muscles could be an important part to think about also, or just endurance of those muscles, so they are better able to handle the pounding. Okay, so they put less load, so there's less load transmitted up the chain into that inside of that knee joint. So heading up, further up, we go look at the hip. So, is the hip too tight? Are the local muscles weak, which is often the problem, quite often the problem, in most people, I think. So if those muscles are weak or they're too tight, right? Or the hip joint is too tight, it doesn't have adequate mobility there, so it's asking the knee to move too much. So always look above and below the joint when you're addressing these issues. So the type of problem it is, the patellofemoral issue or the patellar tendonitis going on, or the irritation of the meniscus or the MCL that's getting irritated there. And then, okay, what's happening at the hip? If the hip too weak, is it too tight? Right? Okay, what's happening at the foot? Is the foot doesn't have enough support, needs better arch support, or the local muscles are too weak? So look at all those factors, and maybe even up the chain. Do I have, or is there less, not adequate rotation at the spine taking place, right? You're too rigid through here, which is going to start changing the mechanics down the chain too. So I hope that gives you an idea, at least with that inside knee pain, which of course can present as not only pain, you could have swelling, you could have tenderness to touch, you could have inflammation. So any of those things can be going on with that. So, but it can be taken care of, it can be addressed very effectively so you can continue to run. I do it every day with a lot of my patients. So think about those things. If you have any questions, leave a comment. Make sure you click on the link below to check out my site. I have lots of information on it, and subscribe to the channel. Thanks.